Key Principle 7 disseminates findings to all partners and involves them in the dissemination process. So results are shared in multiple venues. We present to local press. We invite local press. We have press releases, community forums, included peer-reviewed publications, as well as presentations at professional meetings. And Yolanda is one of our partners who travels with us and does a lot of this, and we are always presenting together as co-authors or co-presenters. So we do not necessarily go to a presentation and alone. And so the academics don't go alone. We always travel together. We have fun together as well, so that's important. Key principle number 8 promotes long-term process and commitment to sustainability. This is our commitment. As I mentioned, sometimes we don't achieve the sustainability piece, but we continue to work towards that. And I will also say that the partnership itself is a process of sustainability, because we've been working together in many ways for the past, I know Yolanda's been involved since '92, I've been involved since 2000, so in a lot of ways we've built this family as well in our own community.
It's 98. I've been involved.
Oh, 98,
Village
sorry.
Health Workers have been around since 92.
I aged you.
So the application of the CBPR approach. Now let's move into this application. It's important to understand that CBPR is an approach to research, and by which researchers conduct research, or understand that CBPR is an approach to research process by which research is conducted. CBPR is not a specific method or research design. Thus, there are no CBPR methods. Rather, CBPR studies can involve quantitative methods, for example, surveys, environmental audits, and qualitative methods, such as focus groups or in-depth interviews. CBPR studies can also use multiple research designs, for example, case studies, longitudinal, quasi-experimental, and randomized staggered interventions.
So thinking about the CBPR approach and how it impacts research, we can begin by looking at descriptive research. So many of us conduct descriptive research to identify multiple determinants of health, and that may be to identify which communities are being exposed to diesel emissions or other. We also conduct research to understand disparities in health status and health-related risk. Then research to understand community needs, problems, resources, and assets, and use those to inform any efforts to design, implement, and evaluate interventions or policies. So this all contributes into rigorous research that is being conducted to inform the design of these interventions, and hopefully policy as well as sustainable projects and programs are being introduced into communities. One of the critiques of CBPR that I often hear is related to the rigor of the research itself. And the approach of working with community partners actually makes the research more, I guess it increases the richness and the understanding of what a community needs. But the methods themselves are not compromised in any way. As I mentioned earlier, we still conduct randomized controlled trial research designs, and we have worked together to come up with different strategies. So it may be that our terminology and our language has changed. We don't say intervention, we don't say treatment group and comparison group. We note them as intervention group and comparison group, or delayed intervention group. We work together to identify what is the best approach depending on the intervention for moving forward. Is it a delayed intervention design that we will find out if the intervention works and then implement it in the control group or comparison group, and how we can work with doing that. But we don't compromise the design of the research itself. Right. So that is one of the myths, I would say, about conducting CBPR work. And also, it is time-consuming. because as we've noted, we have processes, and we communicate a lot. We meet to discuss what our design will be. We, looking at this research, the 4 types of research that we conduct, each process is reviewed by the steering committee. So we oftentimes meet to review, come back, decide how to move forward, and then move in that direction. So there are 7 core phases of CBPR, and we're going to go through those. So if there are any questions related to that part of the presentation, we can take those now. And also, Robert, do you want to come up at this point? No, not yet. Okay. Are there any questions? Okay. So now we're going to introduce the core phases of CBPR. Specifically, the learning objective is to identify the core components, phases in conducting community-based participatory research.
Okay, the first core component is forming a CBPR partnership. This involves such processes as identifying potential partners and communities to be involved. And as Melissa was just talking about things being time-consuming, the process by which we make decisions or do anything, you have to consider that when you're choosing your partners. And you also shouldn't make assumptions about what community partners have to do with their time. A lot of times, you know, we get into some struggles about how many times we have to meet about a particular thing, and it seems as though researchers or academia don't realize that community partners have to actually do a job. Okay? But also, we have to work at building trust and relationships, establishing operating norms and CBPR principles, and creating the infrastructure for carrying out the research process. The second one is assessing community strengths and dynamics. And this involves asking questions such as, what are the strengths and resources in the community? And which are the influential organizations? And where's the power in the community? And who needs to be involved to ensure community buy-in? And this, again, is a bit of a tedious task, but it's very much worth it, as everything we do has, it requires time, it requires commitment, and you don't want just any organization, an organization that just popped up today and has no history. They don't have any power in the community. You really want to deal with people, and that's not to say that new organizations can't be involved, but you really want to identify those that that really can make a difference in what you're trying to do.
And those 8 principles are guiding us through this process as we move through the phases of conducting the CBPR research approach.
Identifying priority local health concerns and research questions. This is a key question here, is how do you figure out what are the major health problems that impact the community that a partnership might address?
So the 4th component is the designing and conducting ideologic intervention and or policy research. And this is where we begin to work together specifically to identify those methods and mechanisms that we will use. Then the 5th component is feedback and interpreting research findings. Again, you know, based on those principles, we felt that it was very important that we do use the information, the research findings, in some way to promote health and also the program and partner stability and sustainability. Many of our partners use that feedback from the research findings for their own grants, in writing their own grants. This is used in background information, introduction of an issue or a problem, as needs assessment data as well. Then the next component is disseminating and translating research findings. This is where we work together to make sure that those findings that we have identified are translated for use, and not only by us as community partners, but are disseminated to others and who are interested in the CBPR approach. And then we go through this identifying and maintaining and sustaining and evaluating the partnership as well. So this is how the formation of the partnership goes through these core areas, and each of these areas we're very cognizant of how are we working together. So we go through and evaluate, is this still an equitable partnership? Are people and partners still engaged at every cycle and every part of these components? And making sure that who's attending the steering committee meetings, what partners are continuing to come, what partners are not, and why. How are we going to maintain that partnership and equitably engage someone to continue through the process? So that is always at the back of our minds as, you know, we're moving through with the steering committee, and sometimes it'll be that Yolanda will call one of the other partners, or I will call Yolanda and say, I haven't seen you in 2 meetings, where are you? And this is what we're doing. But we have mechanisms, we have email lists, and you know, we have ways to communicate about what our meeting agendas are, what we will be discussing, so at each of these phases, we continue to maintain that engagement of the partners. And that's really an important piece of applying the principles. Are there any questions related to the core components? Yes?
Is this from you, or is this from the source?
This is from us. This is the process that we work through.
Have you published on this?
This one is included in the chapter, I think. The CD-ROM as well. And what I'll talk about at the end is through the URC, we do have a CD-ROM training that includes a lot of this information in the slides that we're using. So this is specifically the phases that we use in conducting our research processes. And I think that I keep looking at Robert, who is the program manager for the URC. And he and Julia have copies of those CD-ROMs, so we can mail those to you. You can get those.
So if there are no further questions, we want to look at determining whether a study uses a community-based participatory research approach. And if you're trying to determine whether a study you're working on or one that you know about uses CBPR, there are a number of questions that you can ask yourself, such as, who chose the problem to be studied? Who designed the intervention or policy change? Who writes the papers and makes the presentations? And where are the results disseminated? Where are all the results disseminated, and by whom? And if you answered any of these questions with the researcher alone was responsible, then the study would not fit in the CBPR. You have a question?
Yeah, you know, as you go on and on, you talk a lot about equity and being equitable at pretty much every level of this. And I'm wondering, are the salaries and the stipends also equitable?